All right. Super proud of you guys. I'll bet all of you guys that got it right. I hope all of you guys attended the live course. So yes, if you hear addiction, I want you to think of dope and GABA. So that means dopamine, right? Your reward, the feel good. You do something good, you get a reward. Positive enforcement is dopamine, right? And GABA for things like anxiety. um, Benzodiazepines is full of GABA, right? So it kind of relax. It's very addicting. Anything that feels good too fast, it is addicting, right? So yes, dopamine and GABA is the one that we are most concerned with when it comes to addiction. Okay, good job, everyone there. Next question. Janet, again, super fast. Sami took the second place. Which of the following brain areas is not affected by attention deficit hyperactive disorder? ADHD is not. The frontal cortex, the pons, the basal ganglion, or the reticular activating formation system. Right? What do you think? We're looking for the exclusion here. All right. So the pons, right? Remember who lives in the pons, right? So the pons is not. If you another way of thinking this, what is the job of the pons, right? So it is not has nothing to do with attention. When you think about attention, think about the prefrontal cortex, the basal ganglion, and the reticular activating system, right? So that would be the correct answer. So the pons has nothing to do with ADHD. What do you have to do before you release confidentiality of medical records? 30 seconds left. Okay, this was a piece of cake. I just want to reiterate a few things. If you have someone with a alcohol use disorder or someone with any kind of psychiatric disorder plus a substance use disorder, you need two, not one, two informed consent to release the information. If you are going to release the information to the pharmacy and the pharmacy is, let's say, Walgreens, is not part of your system that you work with, you also need informed consent confidentiality in order to send that medication to the pharmacy. What else? You need to understand the when can you break confidentiality, right? These things are important. Everyone got this question correct. Good job here. All right, Jeanette and Samid still first and second place. As a PMHNP, you are aware of the side effects associated with SSRIs, particular sexual dysfunction, which herbs has shown some efficiency in short-term reduction of sexual side effects related to SSRIs. The belladonna, yoshimbini, Valeria, or catnip? What would be the best choice? Alrighty. So yes, Yoshimbini has been shown to reduce sexual dysfunctions short term, especially in males, due to SSRIs or sexual dysfunction in general. The other medications, there are more calming medication, more for anxiety. There are medication. Other herbs, they are more calming, less activating, more of a sleep aid and for anxiety. So, yes, that is the correct answer. Mark that down. 24 years old patient with an extensive history of IV drug abuse presents with symptoms of affecting various cognitive functions, including memory, reasoning, judgment, concentration, problem solving, personality, behavior, and speech. Additionally, she experienced a balance problem in coordination, hyperflexia, and hypertonia. What's the first course of action? Would you order an MRI? Refer to the CPC or an IV and the CBC lab test or the CT scan? Okay, I know some of these symptoms are of concerns, right? And you could think, well, maybe I need an MRI, maybe I need a CT, right? So let's clear up some confusion. The theme of the question said IV drug use. Anytime you hear IV drug use, the first thing that should turn the light on for you is HIV, right? So, what is a quick, simple way to find out? Order a HIV lab test, right? Maybe her CD4 counts is low. In that sense, well, all you have to do is order the medication, right? In reality, it would not be you who would be ordering, but it would be your job to identify that. Okay? So CT versus MRI. Most of the time, if it's coming through the AD, do a CT if you must. MRI takes longer, so eliminate MRI. And you do not want to refer. Why? Because you can do something for the patient, so don't refer. All right. All right. You're treating someone for generalized anxiety disorder with Lexapro. She she do her GAD-7 and her score is 4. What would be your recommended course of action? All right. Have you ever heard of the terminology don't mess with something that's working? Okay. If the question is not a good question to begin with, right? The better question would have been, you've been treating this patient for the last 4 weeks. What should you do now? And her score is 4. It decreased from 21 to 4. Or you've been treating this patient for 8 weeks or 9 weeks. Whatever her dose is, you don't change it. It's working. Okay? So if I get a patient and I initiate the treatment at 10, and then after 6 weeks or 8 weeks, I went to 20, and then she came back to see me again after 30 days and her score dropped to 4, I would not drop my medication to 10. I would keep it 20. Now, the same case, she was at 10, and then she came and her score was 19. 4 weeks later, she came back, her score is 4. I don't do nothing. I don't change the medication. If 10 is working, you don't change the medication. Okay? Don't mess with something that's working. Okay? Can't stop. Well, yes, I can. What is your question? Please go ahead.
Yeah, I was wondering what the best way, what is the scale to know the numbers,
So
to
the
determine?
question
Mhm.
is not about the scales. The question is the scale is just a is just something to trip you. The question is about timing. Okay? And the question is about don't mess with something that's working. Because it
Right. How do
works
we?
like
How,
this. So how
hmm
do you know? How do you know,
Yeah.
right?
hmm
So you do not change any medication for 8 weeks to begin with. Don't care
Okay.
if it's worse or better. Some people would say 6 weeks, 6 to 8 weeks. Let's say you started someone, let's give some an example. Started someone on SSRI, Lexapro, initial score, PHQ-9, 20. First action, what should you do? You assess for suicidality because you have a high PHQ-9. That's the first thing. Your first order is not to order medication. Same person, PHQ-9 was 15. You okay? So it's high, moderate, right? Started on Lexapro, 10 milligrams. Patient comes back. Now, it doesn't matter what the score is. You don't change the medication in 4 weeks. Doesn't matter if
Okay.
pH now is 2. Now, if the pH now is still high, you what do you do? You assess for suicidality, but you don't change the medication. Now, 8 weeks in total, the patient comes back. Now, the next best action would be to increase from 10 to 20 after 8 weeks, 6 weeks. Some books are 6, some books has 8. I like 8 weeks for test purpose. 8 weeks.
O-
And that's
Okay.
that's
Great.
why I
Thank
said the
you.
question wasn't really good because it didn't give you a time. It just gave you a score.
hmm
It could have been a better question, but it's really trying to trick you. And they will try to say, okay, the patient's feeling really good. And the score is now 2. So it's basically it's trying to say, hey, go ahead and decrease the meds. And that's where people tripped up because they're looking at the score and they're going
mm
automatically by they base their action based on the score when you should base your action on the knowledge that it takes 8 weeks to see a change of any antidepressant, right? Quote unquote. Not quite
hmm
there, but yes, generally speaking.
Okay.
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 All right.
Great. Thank you.
Do we
hmm
have another? Yes. Do we have another question there?
No, you answered the question I was going to ask about the
Yeah.
time frame. I think it was the question itself did not include a time frame. So
Yes.
if we see that, if it does not include a time frame, you're saying just to kind of go on the knowledge that, typically you will wait the six to
Yeah.
eight weeks
Yeah,
and
because even if it's a bad question, it would not be a question like that. This question would not be fair. But because it didn't give you a time frame, right? It should have said, "Hey, 4 weeks," and there's basically trying to have you decrease the meds. But you know that you don't decrease the meds. You know that you don't increase the med. You wait say 8 weeks, right? Or would say is higher. And if it says higher, then you assess for suicidality,
Mm. Thank you.
right? And then if it's after 8 weeks, now it's debatable whether you should increase the next dose or try something else, right? But they are not going there because that gets a little bit more complicated. Okay. All right. Hashida, please, what is your question?
So the rationale behind you after you assess the suicidality, um, you still don't like increase the medication. Is that because maybe that
Um,
person is having like maybe a stress day or has a stress day or stress week?
yeah, but more so that the rationale is that if it's not 8 weeks, the medication has not worked to its full potential.
Uh, Okay, okay, that makes
So
sense.
that's what they want to see. It's like they don't want you to rush into adding more or taking away, knowing that it takes about 8 weeks, 6 weeks to have the full dose achieve its full potential. Remember, we are not giving the patient anything. We're not giving them um, serotonin. All what we're doing, we are messing with the transporter. So this is the receptor, right? So this takes us to the receptor. This is the synapse that shoots the message. Boom. And the message tries to connect. And then when the messenger, serotonin, doesn't connect to the receptor, the pickup mechanism, right, with the transporter, picks it up and break it down and makes a new one. So what the medication is doing is locking this transporter. So now your body just makes it. And you
Mhm.
over time, your body will be like, geez, there is a lot of serotonin in my head. Now you have a headache. Gee, there is a lot of serotonin in my gut. Now I want to, maybe have nausea feeling. Maybe you'll have a loosey stool. And over time, your body will start sending receptors to connect it to the excess serotonin. And that is when the action takes place. And this why it explains why it takes 8 weeks, 6 weeks for most folks to kind of really
Mhm.
get the full effect. And that's what the test makers are, you know, want you to understand. It's not a direct question, right? It'll be like
Mhm.
application question that you understand the principle and you are able to apply.
Mhm. So like what you were saying, like you're experiencing like the upset stomach, the headache. You still won't increase it. You'll say, okay,
Wait,
we'll
we write it out.
wait, keep
Yeah.
it. Okay, okay.
We write it out. We don't do anything. Explain, drink a lot of water. Now, if when do we stop? There is one exception that to the rule, just one exception. If the patient, yeah, that's a good point. So if the patient comes to you and was taking SSRI, so write this down, guys. This is actually a very important exception, and you may see this again. So if they are taking a SSRI and score initially PHQ-9 was 19, 20. You assess your actions to assess for suicidality, no suicidality. Now you'll give a medication first time. And now 4 weeks later, the patient comes back, PHQ-9 is 4. And then she goes, wow, life is great. I didn't know what I was missing out. I'm sleeping better. I'm working more. I feel more energized. So very good. But I kind of want to just talk to you about one small thing and you go like, oh, what is that? I'm having those suicidal thoughts that I never had it before, but I have no plans. Oh, yeah, let's say that. So your action at that point is to stop the medication. Okay.
Okay.
So the only exception is if the person didn't have suicidal thoughts and
Mhm.
now they do, or those suicide thoughts becomes more intensive. And that your action now, despite of all the improvement, that's another trap. They'll kind of guide you to believe that everything is okay. They'll guide you to believe that the the it's just thoughts, no plan on action, right? We have a higher tolerance in real life, but in tasks the tolerance is really small. So they start having thoughts that they didn't have, or those thoughts became more intense. Now your action should stop the medication.
Okay.
Okay?
Okay. Thank you.
Absolutely. All right. Let's go ahead. Next question. So TB, it's climbing the ranks here. So basically, which medication has been approved for children or adolescents, FDA approved? Which is a okay. All right, so I'm just double checking here. Zoloft, right? So when you check Zoloft on my app here, it says it's major depressive disorder, but it doesn't say the age. But for OCD, it will be 6 and up, right? If you look at Prozac, it says major depressive disorder, age 8 and up. Different apps. I use one that I like, but Prozac has been FDA approved. It doesn't mean that you could not try Zoloft for others, but FDA approved for children and adolescent. Prozac is one of the oldest and most studied medication. Okay, Praxil, absolutely horrible medication that gives a lot of side effect. In my personal opinion, clonidine is one that we used a lot for children and adolescents, but for symptoms of ADHD, maybe some irritability. And Zoloft is also used a lot. Zoloft is approved for children 6 and up for OCD symptoms. Okay, so we talked about metabolic syndrome yesterday. Which one has the highest risk for metabolic syndrome? All right, we have 9 seconds. Pick your best answer. Okay, perfect. Okay, one of those that got the green check there, olanzapine and Zyprexa. Someone give me which CYP50 does this medication work on? Unmute yourself.
CYP 1A.
2, correct. 1A2. What is the number one metabolic syndrome that you would see after starting the medication?
Increased waist
Increase
Circumference.
Okay, so
Circumference.
increase of the waist circumference, right? Okay, so if you are prescribing Zyprexa and someone smokes, would you prescribe a higher dose or a lower dose?
you
Higher.
higher, right? If the person stops smoking, you decrease your dose. Now
Yeah.
write it down. Latura, Abilify, Geodon. Those three meds are called the skinny meds, and the and the others, but those three precisely, these are skinny meds. So these are the best antipsychotics for uh, to prevent metabolic syndrome. Okay, acenopine is also another one that's good. Geodon, you need some food with it for better absorption. Okay, all right. Next question. All right, someone with depression and increased alcohol consumption. How could you phrase a question to better understand the situation? Okay, so if you're assessing someone for alcohol use disorder and depression, right? Perhaps a similar question like is tell me about your signs and symptoms of depression and your relationship with alcohol, right? It would be a better question. But out of those four answers, do you drink socially? It's not a good answer, right? No, I drink because I'm super depressed, right? Can I refer you to a treatment program? How can you refer someone if you haven't really assessed them fully for whether they have an alcohol use disorder that needs a program treatment? Are you ready to stop drinking? That seems a little bit derogatory, right? So a better question out of those four would be, have you been drinking alcohol to cope with your depression? Even though it's a leading question, it could be better rephrased, such as, are you feeling depressed? And what is your relationship with alcohol? Something along those lines. Okay. Try not to do a leading question and try to phrase it in a way that's empathetic and also covers alcohol and the depression symptoms. Go ahead, please.
The reason why I didn't choose is because it seemed like you're like more accusing or persecuting a person, or like you're. I don't know if I
Yeah,
said
you're
the
right. Yeah, I also felt the same way. You're absolutely right. That's why I said a better way of asking. But it was the also only question that addressed the two conditions, right? So if you were stuck, look at the stem of the question, and they said alcohol and depression, and one of the answers said alcohol and depression. If that's one of the answers that you're like, I don't know if yes or no, right? Probably there will be a way to go. Another way to go is the other answers. They were actually a little bit more of uh, well, are you drinking socially? It's kind of like almost making an excuse for the drinking, and the other answers didn't provide as much detail. So oftentimes you will find it difficult to pick an answer for these reasons. It will never be clear cut. Hey, that's A for sure. Right?
Mm.
So, all right, next questions. Moving on. Disrespect for norms and rules. Those aggressions towards people and animals without remorse. So right there should be extremely easy to find the answer. Is this reactive attachment disorder, oppositional defiance disorder, disrupted mood regulation disorder, or conduct disorder? Anytime you hear cruelty towards the animal without remorse, there is a high chance that this answer would be one of the fours. Okay, very good, guys. So anytime you hear cruelty, destructions improperly without remorse, think of conduct disorder. Anytime you hear a kid with labile mood, like a bipolar patient for kids, but more irritable, that would be disrupted mood dysregulation. What do? You give them a mood questionnaire. If you have symptoms of a kid with the bipolar like symptoms, what do? You give them a mood questionnaire. I would write down this answer. Oppositional defiance disorder. Anyone, any of the kids that have problem with the person that's in charge, whether it's a teacher or parents, but has to be in different settings as well. That would be the oppositional defiant disorder. Okay. All right, we are ready to debate this question, as I know many of you guys will get it incorrect. So let's see if you could prove me wrong. If you've been in the course, you know exactly what to do. We have 7 seconds left. All right, as I mentioned, some of you guys would get it incorrect. So 9 years old, possibly sexually abused. Parents are in the bathroom. At that point, you should talk to the patient separately. Okay, interview the patient separately. You collect information, then you take action. Same scenario, similar scenario. 9 years old comes to you and says, I've been sexually abused by my cousins. This scenario is not the parents. You interview the kid with the parents first. Then you call CPS. Third scenario, mother calls and says, my youngest daughter has been sexually abused by her older brother. Your action is stay with the mother, stay with your kid, with the daughter, and don't leave her alone. Third scenario, fourth scenarios. Someone comes to your office, older, not older, but 25 years old female, and says, I was raped yesterday. Your action is to provide for safety for that moment. It's not to collect specimen. It's not to call the police. It's to say you are safe here. How can I best support you at this moment? Different cases, different scenarios, right? And you have to understand that if the parents were the abuser, then at that point you want to collect more information, interview the patient as much as possible. Then your actions to call CPS after. Okay. You have a higher degree. Your job is to collect the information and you pass it on the information when appropriate. Not just simply, let me call CPS immediately, right? I can't stop now, but next one I'll do. You should know your Erickson stages in detail. Okay, so the question said he felt inferior to his friend. So if you didn't know how to look at the answer, right, you're like, oh, industry versus inferiority, right? So during this phase, it's important for the children or adolescents, right, to feel that they are growing and achieving their milestones. If they don't, if they can't read, if they can't do math, and their friends can, they will feel less than the other kids. Okay. What is the question? Someone had the questions previously.
Oh, yes. In regards to that question, so we wouldn't call the police at all in all those situations, because my thought process would be like we would have to call the police in order to get a report first, and then.
Sure.
Mhm.
Sure. Yes, you're absolutely right. Right. But it's more like your first action at that moment, right? So it's to collect a little bit more information and care for the patient, right?
Mm.
And then you call CPS
Oh,
police.
yeah, 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 yeah. I actually got that right. I actually got the question right. But like after you've taken like the information from the child or the
Yes,
parent, then I was thinking you then call the police instead of calling
correct.
CPS.
Yeah, you could. You're not wrong. You're not wrong, right? You're not wrong because I don't think it's it's one next to the other. Once the police gets there, secure the information, make sure the child is safe, and then they would call CPS or you would call CPS. It's not incorrect, but you are right,
Okay.
absolutely right. Okay,
Okay.
but remember that on task in real life, several things happen instantly or just one behind the other action. On the test, they want to know exactly the first or the order of things. Okay.
Okay.
Yeah,
Uh,
yes,
Aaron, go
yes,
ahead.
I'm also of the same concern that in this case, we have to provide safety first for the child. And
Yes.
on that reason, calling CPI or even the police will be the right thing to do before interviewing the patient separately. That was why I went for that answer as calling CPI. Because
Right, right.
safety first,
Absolutely.
you know.
Yeah, but basically, what the test wants to know is, are you able to collect a little bit more information? Are you able to get more information about the case before you take action? Right?
Exactly.
So yeah, so it's kind of muddy, and
Yeah,
that's why I said a
I
lot of
thought it would be
people.
like prematurely if we were to call the CPS. It'd be prematurely
Correct.
for
And
like getting
yeah,
everybody.
correct. So basically, the test wants to know, as a master prepared practitioner, one that deals with mental health in a crisis situations, what should you do? Simply call the police, right?
And
No,
tell them
simply,
what?
yeah. Oh, the child said she was sexually abused. Okay, fine. But
Mhm.
until then, where you gonna leave the child, right? So what
Exactly.
you should do is, you're safe now. Let's see how we can best support you. You are safe at this place, at this location. No one will likely do this to you again. Let me help you.
Yeah.
See, a little bit more support, and that's what you're trying to do, rather than, okay, anyone can call the police. My 6 years old can call hear that and call the police. So what's the difference between you and her, right? So basically, as a trained professional, you are there to provide brief support therapy, right? Brief support therapy and protect the child. Now, we don't want to, now it's different if the accuser, it's someone else not in the immediate family, the parents. Then you want the parents to be alongside the child, okay? And again, guys, it will never be easy. The questions will always be muddy and difficult when it comes to, because different states, different rules, different ways of seeing the questions will pursue, will make you change your answer. But if you find this guideline where provide brief support therapy, provide collecting some information before calling CPS immediately, you are more likely to get them correct than incorrect. Okay. Any other questions about this subject?
I have a brief comment, if I may.
Sure. Yeah, please.
In interviewing the patients separately, that would also allow the NP to have some definitive information to provide to the police or CPS, rather than just handing off the 9-year-old and saying, well, she said she was abused, and kind of
What do
throwing
you know? Yeah.
Yeah, you would have to have some type of I would think some background, so you could look into it further and then provide that information to the authorities before making that phone call.
Yeah. And there's never easy situation. It's never easy
No, it's
situation.
not.
And always going to be muddy, especially on the test. But think of your role as the provider. What should you do first? It doesn't mean you're not going to call the police. It doesn't mean you're not going to call the CPS. But your initial action, your best action, your priority action, all the same things, right? So it's asking, hey, what do you need to do exactly at that second, that minute? And then you do everything else. Okay?
I have a
Right.
contribution.
Yes, please.
Yes. Yeah, that's exactly the right answer. Intervene the child separately. But in any case, if the parent is abusing them while you are trying to interview them and causing some kind of a violence in front of you, then that's when you call the police right away.
Absolutely. Then you have to escalate the, if that said that, hey, you're trying to interview the parents, but the parents is knocking on your door, shouting, say, open the door, then your actions to call the police next. All right, next question. Talk about cover. And we talked about dark. Oh, Yuri. That's right. Right. Now the abdominal pain. Which lab should be prioritized? You have cover. You know a lab that you should get. You have Epicoat. You know a lab that you should get. All right, guys. So good job. Very good, right? I can see why some people went to CMP, and I get it. But the rationale here is more specifically for LFT. So anytime you have liver, anytime you have DEPA code, you should remember the 2 FDA warnings for that. You should distinguish what do they look like. You should know what labs to collect, and you should know to collect ammonium. Anytime you hear kava, you should collect that LFT. You should not give kava with anything that makes one goes to sleep sooner, like benzos. Anything like surgeries should be stopping kava. Okay, so hopefully you got this from the course and you're on your way to be board certified in no time. Next question. So MMSE, right? Who is the current governor? Who is the president? What does it mean? What are you assessing for? Should know your MMSE in detail, in excruciating detail, because right from there could be easily a 3 to 4 questions. Sorry, my apologies there. The key is incorrect. The answer is fund of knowledge. So my
Yes.
apologies. Yeah, so let's talk about other things on
Yes.
the MMSE that you are you need to know. Recall, registration. Registrations is any 3 elements or things like a phone, key, and the pencil. Now, can you tell me the 3 things that I just showed you within 1 minute? That is registration. You're able to register the items that I showed you and repeat it after me after 1 minute. Now, the same thing. Cell phone, chain, and pencil. Memorize those 3 items. And I ask you, who is the current governor? You assessing fund of knowledge. Now 5 minutes has passed, or after 3 minutes. Do you remember the 3 things that I showed you? Now it's called recall information. Registration before 1 minute. Recall usually after 5 minutes or within 5 minutes. Okay, very, very important. Distinguish between registration and recall memory. Okay, you should know that. Fund of knowledge, I keyed in incorrectly. Most of you guys got it correct. So cognitive status, is part of the whole MMSE is your cognitive status. Orientations, date, time, and place where you are. Okay. But I see everyone kind of went for each one of those options, and you should know MMSE in excruciating detail so that you don't lose those easy points. Any questions about this?
Are you going to give us the credit now? Switch the answer
Next question.
one.
My apologies there for the messed up. It's no music.
I can hear it.
So you have someone that's 68 years old, has been in the hospital for 1 week, and you assess the patient after notice changes in mental status. What happened? We have 5 seconds left. Okay. Delirium, right? Someone was okay and no longer was okay after a week in a hospital. Very common, especially in ICU. Now, dementia, it takes a long time, years to develop. Schizophrenia, it didn't really say anything close to schizophrenia. Lewy body is a type of dementia in which you have visual hallucination. What you do not give for Lewy body is antipsychotics. Okay? Good job there. So which two medications are well known to have paradoxical activating effects, especially in elderly patients, and should be avoided in the future due to this? In elderly patients, two medications that are well known to have paradoxical effects. It's a hard question, right? Okay, so yes, that's why I said it was a hard question. Now, when it comes to elderly, SSRIs could cause them to have anxiety. Now, two medications that are known to have paradoxical effect is lorazepam or Ativan and trazodone, meaning that instead of calming or putting them to sleep, they may be more agitated. I know barbiturates and benzodiazepine looks like a good choice, but the correct answer would be trazodone, especially trazodone. Okay. Very hard question though. Okay, so last Friday we covered few conditions that could mimic bipolar. If you know the condition, then you would know what to do next. We have 10 seconds, pick your answer and go. 5, 4, 3, 2, 1, go. Yes, right? Hyperthyroidism mimics bipolar, right? So what you need to do, get a TSH level. You should know in excruciating detail what is the TSH level and how to assess it. Okay, so good job there. Most of you guys got it correct. Jeanette, she's just taking the lead again. Good job. All right. We talked about chlorazil yesterday. ANC, it's 800. She exhibits no signs of infections or fever and remains asymptomatic. However, she has experienced previous episode of agranulocytosis during past chlorazil trial. What should be your most important, what are you going to do now for this patient in managing her care? Asymptomatic though. Four seconds, pick your best answer and go. Guys, we covered this in detail, excruciating detail. Clozaril and carbamazepine both can cause agranulocytosis. Anytime, I don't care what else the question says, ANC is less than 1,000, stop the medication. If WBC is less than 3,000, 2,000 to 3,000, stop the medication. Don't care what the numbers are at all. If the patient has fever, sore throat, runny nose, you stop the medications. It doesn't matter what the question says, feeling good, asymptomatic, symptomatic, or what have you. These are hard stop. ANC less than 1,000, symptoms of infections, or even the white blood count. It's less than, between 2,000 and 3,000, and it was really high before, stop the medication. Okay, these are easy questions. If you have taken our content and you are really digesting the information, these are hard stuff. The question should not trick you. So we talked about opposition defiance disorder today. Why you want to prevent that? And what do you have to do? What is the recommendation? You want to prescribe some medication? You want to refer the patient to another provider? Refers the teen to therapy, or help patient gain parenting skills in limit settings? Okay, so the number one goal for oppositional defiance disorder is therapy. What kind of therapy? What do you want to get out of the therapy? Help the parents find the skills and enforcing those skills to setting limits to the behavior. That is the therapy. So the therapy is not only to the child, but to the child and the parents, helping form healthy boundaries. Okay, so it's not to do medication. Could you do medication? Yes, maybe to stop the aggression a little bit, or prevent or less of it, but it's not the main therapy. Okay, refer to therapy, sure. Refer to therapy, yes, but the question asks, what is the goal? What are you trying to get out of it, right? Help help parents gain parenting skills and limit settings. Further development stage. Which stage would this behavior be considered normal? All right, so it's the phallic stage, right? Don't get confused, guys. First thing to know, it's considered normal. Second thing, phallic stage. Okay, that would be phallic stage. Is it normal? Yes. According to this theory, to this development theory, it's normal. Okay. Good job there. Janet, KR, Dean, AJ, and TA are killing it. Okay. I thought it's going to be an easy round, but we got more people join in. So we're talking about the Mini-Cog, right? We talked about the Mini-Cog yesterday. It's a quick screening tool that requires minimal instructions or training. What do we do in the Mini-Cog? All right. So the Mini-Cog is a brief cognitive assessment tool used to screen cognitive impairment, right? To whom? Alzheimer's patients, dementia patients, right? Mini with mild cognitive impairment. It is consists of two tasks. When you hear Mini-Cog, one is the 3 words recall after 5 minutes, right? Uh, recognition less than a minute, so recall 5 minutes. So the examiner says unrelated 3 words like apple, pen, and house, and ask the patient to repeat them afterward, right? So if it's an immediate recall, sometimes it can be immediate or delayed recall. Pay attention what the question is asking. Now, the other thing is the clock drawing test. Is a giving a blank piece of paper and asked to draw a clock, including the numbers and the hand set at specific time. Let's say 11 past 10. Now, the Mini-Cog is based on numbers of words called and the accuracy of the clock drawing. So a score between a score of 0 to 2 is considered suggestive of cognitive impairment. So as you imagine, a low score. A high score would be normal. Okay. But yes, if you hear Mini-Cog, think of 3 words recall and you think of the clock drawing test. Okay. So you have a patient with delirium, right? Has become increasingly agitated. You need to decide which medication to order to manage his symptoms. All right, so very good, guys. I thought this would be a super hard questions, but you got this correct. You know, the better answer really would have been I am Haldol, right? I am Haldol there. Someone asked me, well, if the first generation is such a bad medications, why do we use it? Well, because it's potent, fast, right? So Haldol would be a one to ask, especially for delirium, right? People with delirium, you give it like a I am Haldol. What you do not give is a PO med during an emergency, right? Sir, you're super agitated, take your pills. I don't think that would work out super well. Okay. So rape 3 weeks ago, what would be likely the right diagnosis? You have 15 seconds, pick your best answer. Okay. You guys are doing wonderful, but there are a few things that we need to tighten up, right? At this point, we really need to know the difference between PTSD and acute stress disorder. If you are in the course, we hammer this down in the format that you should never get those questions wrong. And I hope if you if you are confused, please let me know, because I would love to clarify a few things. First, the time. If it's less than 4 weeks, it is acute stress disorder. If it's more than 4 weeks, it's PTSD. So that's the first point. The second is the one that will trip you. Let's say a veteran went to Afghanistan and had been diagnosed with a PTSD. Now, 2 weeks ago, he got into a car accident. Now he's nervous, heightened anxiety, doesn't want to leave his house. What is the diagnosis? Some of you guys would pick acute stress disorder, but that would be incorrect. That diagnosis now would be PTSD. If you've been diagnosed with PTSD, now the new event is heightened the PTSD. Okay? So please do not confuse PTSD with acute stress disorder. You need to know what's PTSD. You need to know that EMDR is the phase, and you need to know the phases of EMDR, because the question could easily give you the phases and ask symptoms and ask you which phase is the patient currently in. Do we have any questions about PTSD or acute stress disorder before we move on?
What about
Thank you for clarifying. Sorry. Just
Yeah.
thank you.
Can I clarify a few things on that? Like, how can I help you understand those two a little bit better, though?
What about panic disorder?
Okay, so panic disorder, very different than what was the panic disorder and what was the other option? You guys remember?
How do you differentiate?
So-
4 weeks or 6 weeks?
Can you repeat that?
Like you said, acute stress is less than 4 weeks.
Yes.
How do you
However,
apply it to
however,
panic? Mhm.
yeah. However, if they ever had PTSD, there will never be acute stress disorder. There will always be PTSD.
Exactly. Mhm.
Okay.
I got that one.
So yes, so that's very, very important. And most of the people will miss this question because they look at the time frame and they're like, oh, that's easy, boom. And then they get it wrong. Panic disorder versus panic disorder versus acute or panic attack. What's the difference? So panic disorder is one in which they had few panic attacks. Panic attacks is once in a while, boom, happened. Oh my God, I don't know where it came from. It just hit me from nowhere. I was walking my dog, and then this immense sense of a doom that I'm going to die just roll over me. That's a panic attack. Why is it important? Because the treatment is different. The treatment for panic disorder, several of them over time, will be an SSRI. A panic attack, it could be something that's more, I wouldn't say benzo because the tests don't like benzos, okay? But something that's more quicker, maybe like even a Atarax. The tests really don't like benzos. In real life, it would be benzos, okay? But try your best to stay away from the test answers, okay? Was that a little bit better?
Sure.
Okay. All right, we got a few more questions to go. Oh, we talked about this yesterday. Brown urine during his appointment, right? His wife also mentioned episode of disorientation, lethargy, and vomiting and nausea. So you look at what you should not do. What you should not do.
Is that considered, Dr. Lopez, a negative response question when you're asking
Yeah,
not to?
yeah.
I don't like these.
Why actually should not be considered as your
Because
next
automatically your
step.
eye goes to what you should do, but I thought
Yes.
that not before I answered, so.
Okay. All right. You should not increase the dose. All right. So what you should do is discontinue the medication first, followed by order the liver function test and ammonia levels. So Depakote, when you hear Depakote in your dreams, you should think about liver function test and ammonia level every single time. Every time you hear Depakote, you smell something wrong, you think about liver, LFT, and ammonia. Okay, and you ordered a valproate order valproate levels, right? Remember, 50 to 125, that's what you want to be just about, right? But the first action should discontinue the medication. What you should not do, no, you don't increase the dose, right? That's what you should not. I know some of you guys was fast, and probably why you got it wrong. And you have, it's so important to read the question and ask yourself, what is the questions really asking me, right? Because we don't want to leave any points behind, easy points. All right, we have someone that's having delirium. You got to call and become combatives. What would you do? Right. So let's say, for example, like you should do an antipsychotic, Haldol IM, right? For example. But let's say that you didn't know what to do. Okay. Then you look at this answer and you're like, okay, PO out in the trash. So you don't pick that because the PO. Are you going to give it to an agitated combative patient that, sure, here's your med, can you put it under your tongue or take a sip of water and open your mouth for me? So you wouldn't do that, right? So we can cross those out. Then what do we have? IM, Atarax. Is that the medication of a choice? No, right? So the only elimination possible choice here would be Geodon IM. Remember, Geodon PO, you want food with that for better bioavailability. Okay. KR took the lead. Good job. Opiates withdrawal is associated with various symptoms. The clinical opioid withdrawal scale, COWS, is used to measure opioids withdrawal symptoms. Do you know which symptoms are included in the COWS scales? That's a hard question. Sort of, right? Don't confuse cows with sewer. Okay. So when you have opioids, the pupils are constricted, right? Now, if you are going through withdrawal, your pupils will be dilated. Yawning. Be readable. It's kind of sick. You don't have a lot of patience, right? So that's withdrawal, opioid withdrawals for you. Um, Paradoxical sweat, tremors, disturbancy. Unfortunately, that was keyed in incorrectly. I think I'll call it one more questions and then we'll stop for the day, because I want to make sure all the questions are keyed in correctly, right? So that would be the yellow answer, okay? The correct answer. Okay, if you see pandas of the strep throat infection, what behavior changes might these children experience? What is one condition that associated with pandas? Is it autism, hyperactivity type, neurological disorder, or obsessive compulsive disorder? We have 30 seconds. Pick your best answer. Okay, so this one is correct, right? Anytime you hear pandas or someone, a kid with a strep throat condition, that's highly associated, at least by research or by the books, because I have never seen in my life, with OCD. OCD. So from now on, the kid was in a hospital, started getting antibiotics. 3 weeks later, starting to have OCD-like symptoms. Your question is, were you in a hospital, you had a throat infection the last few weeks, something along those lines, you should associate it with OCD. Let's try one more question here. Jeanette, she's just like, I want to lead today. So there you go. KR, Jeanette, and DAJ and TA
We
are
can
all
stop now.
funny.
I'm just kidding.
Okay, stop. You stop now, right?
Yeah.
I don't want to.
I'm
Yeah,
just
I want
kidding.
to make sure the next question is the right answer because I didn't get to check them all. So I'm kind of like, let's do it. Let's see. One more, at least one more, maybe two more. Gotta be fast. As a school district employee, you are addressing the issue of a recent tragic suicide involving a teenager with a mental health diagnosis who experienced ongoing bullying. Now, the question is, you aiming to educate both the students and the community while reducing the stigma associated with mental health. Keyword here is the community. What would be the most effective method to disseminate the information throughout the communities, right? Question starts one way, but I'm asking you something else at the end. Very common question. Starts one way, leading you towards something, and then switches on you. Okay, guys, I really tried to lead you right here, right? The question starts about suicide case in the school, but it was kind enough to give it the community answer at the end. And at the very end, it asks you, how can you educate the community? So basically, another way of asking this question is, how can you disseminate this information to the entire community? Would you be focused on the high school? Would you go to the grocery shop? Would you go to publish an article? Or would you go on TV and the newspapers where you can further disseminate the problem and decrease the stigma of mental health? So that's the one you want. You want to go on TV that your news can be heard by others. Okay? Be very, very careful. The question initiates one way and switches on you. So if you not pay attention at the end, what the question is really asking you, you might be asking, what should you do for the school, for example? Okay. Let's see if we can do one more here. Ooh, the fight here is KJ, KR, and Janet. They're like neck to neck. So, treated with lithium to alleviate symptoms of mania. So we talked about lithium yesterday, right? So which one would be the most concerned with? It doesn't mean that you should stop lithium for any of them, okay? Make that very clear. All right, 1 second, pick your best answer and go. Okay, if I have 4 plus urine, now protein in my urine, my kidneys are not working efficiently. Anyhow, if my kidneys are not working efficiently, I should have a eyes open for taking lithium. It doesn't mean I should stop lithium, but which one will be the most concerned? It will be 4 plus. So what do? You monitor the patient. Do you stop lithium? No, no, no. You monitor the patient. Okay. BUN 22. Do I really care? 10 to 22 to 20, normal 22. Does it really telling me a whole lot different? No, not really. Urine osmolarity of 1.020, just about normal. AST, ALT. It's talking about my liver. Why do I care? And the numbers are not abnormal to concern me. It's talking about my liver. So why do I care about my liver? The question is about lithium. Lithium is all about kidney. Any medication that can cause a kidney problem, it is of concern. This specific example, you don't stop the medication. You will continue to assess the patient, but it is very concerning. That means would be one that I would be watching out for. Let's see. Let's keep on going for the next 10 questions. Hopefully they all keyed in correctly, but let's see. Make it to 40. So Larry is excited about science project fair. It's a science project. What did we say about science project? Abstract and logical thinking. That's a clear. Boom. You should know the answer. Pre-operational, concrete operation, sensory modem, or formal operational. Pick your best answer. You got 30 seconds. You should know this one, guys. Come on, this is gonna be okay. Come, Lola. Okay, so it's a science project, it's abstract thinking. It's a higher form of thinking. Anytime you hear that, think of F after C. C is concrete. C in alphabet is before F. F is father. So it's formal operation. A lot of people get confused. Concrete with formal. F is the fathers. It is the concrete abstract hypothesis science project. Formal operation. Write that down because you will get confused. Concrete and formal. F for father, away, right? That helps me like, which one was that? Concrete or formal, right? So you should know that one, please. Okay, you have a 67 years old Mrs. Day, and she's no longer able to care for herself, cannot balance checkbook, pay bills, or has other deficits, right? We'll be conducting tests on her ability to register, to recall, memorize, and recognize written language and words. What would I be testing her on, basically? Okay, I'm looking for her functional literacy, right? Where she's able to bathe herself, she's able to, what she's able to do, right? She's able to buy groceries, she's able to take her medication, right? Basic literacy would be more shorter umbrella. Memory in terms, short-term memories wouldn't necessarily be what I was looking for, or attention. Okay, so functional literacy was what I was looking for, this question. Okay. Presents to the emergency room with a chest pain, sense of impending doom, torticollis, chills, sweating, shortness of breath, nausea, abdominal cramp, and stated that she believes she has having a heart attack and no longer experienced such symptoms previously. However, she acknowledged that something was wrong. The results of the cardiac workup were unremarkable. Which diagnosis are you considering for her? What does it look like to you? She never had it before. Okay, so that's the key. Had not experienced such symptoms before. Okay, so good. Most of you guys got this correct. We covered this today. Panic attack. Boom, one time, maybe two. She had this panic attack. Panic disorder. She's been having those attacks more often. That becomes a disorder. A panic attack is once in a while, boom, it just happened this year, last year, could be considered a panic attack. Disorder is more often panic attacks, okay? And it did not say anything about acute stress disorder. It did not say anything about timing. So therefore, it could not be acute stress disorder, okay? All right, we covered this. So hopefully everyone will get this answer correct. We have 15 seconds. Pick your best answer. Perfect. Well done, guys. Very proud of you. So it's a 4 weeks. It wasn't nothing to do with suicidality. If the question had brought suicidality, the action should stop. 4 weeks, we do nothing, keep things as they are, reassure the patient that takes about 8 weeks, and continue the treatment the same way. Doesn't matter if the HAM-D came back as 0 or came back a little bit elevated, as long as there is no suicidality involved, you keep the plan as is. All right, let's keep moving on. We got 5 more to go. Why the treatment would not be recommended for me just because I am too poor to afford it? Which ethical principle does this statement emphasize? Justice, dignity, veracity, or fidelity? Pick your best answer. Yes, that's justice, right? Justice is doing what's fair. If it's a clinical trial, it should be available to everyone, or at least offered to everyone. It's not about the price, but it should be offered. It's the patient's decision whether she can or she cannot afford, or if that is a good treatment for her. Now, veracity is telling the truth. Fidelity is what you want of your spouse, I hope, right? You want to be fidel, meaning from the Latin, faithful, right? And dignity is not even part of our ethical principles there, but you want to treat all patients with dignity. Okay, good job there. What are some of the Yalom's therapeutic factors that outline the benefit of group therapy process? We have 19 seconds and 19 answers. Okay, 10 seconds, pick your best answers, and let's close it. 5 seconds. All right, very good. Yalaman, so you need to go those 11 group therapy, benefits of group therapy. They are actually very easy. We teach about them in the course. You will know them in detail. Now, can someone unmute yourself and tell me hierarchs, genogram, and boundaries? Which therapy am I most likely referring to? Give me your best shot.
Structure,
Family
Yes.
therapy.
family structure. Yeah.
Yep, family therapy structure. Which therapy am I referring to? Self-differentiation triangles and syllabine positions.
Family system therapy or systemic.
Family. Yep. Family system therapy. Good job. Altruism. What is that?
Right. Sharing their feelings towards others.
Okay. So sharing, right? So installation of hope. Yes, there is a reason I'm here to get the hope when I see others in the same condition, bonding together and bringing each other up, right? And existential factor is what's the reason of my life? right? And then find the existence, why you are alive and why you are here today, and that you can still serve your family, yourself, this world for many other reasons. Okay, so good job. Okay, let's see there. Good job, KR, Janet, Dean, AJ, and Faye. You guys are absolutely killing it there. Good job, everyone. We got a few more questions for today's event. Mr. Goldberg has erectile dysfunction and is prescribed the phosphorylates type 5, or just PDE5 inhibitors for treatment. So this medication is effective for AD because of what? What does it do?
I don't know.
Because it have a slower absorption throughout the oral route, easier administration, easily administration through IV route, have rapid absorption through the oral route. All right, so very good, right? So any medications, it can be the best medication ever. However, if it's not convenient and if it's not easy to take, then it doesn't really matter, right? So one of the reasons why this is one of the best medications, because it can be rapidly absorbed through oral routes, right? So yeah, absolutely. So Janet, she's in a row there getting the little strikes. 10 correct answers in a row. So good job. We got a few more to go. So you have a 78 years old Mr. Brad with problems with concentration, language, and memory, confusion, withdrawal from social interaction, decision making. Cognitive deficit has been interfering with his ability to care for himself over few months, right? So upon administering MMSE, the score obtained was 8. Keyword 8. Okay, very good, right? It has nothing to do with the CVA. Hopefully nothing to do with the brain aneurysm and delirium, right? Delirium is short. Delirium, the guy comes in, or the gal comes in, goes to the hospital, everything is good, stay in bed, get a UTI, and then becomes delirious. It becomes delirium, becomes part of the problem. Dementia, it takes time, years, months, right? And then you have to fit pseudo depression in the equation there too, right? So which mood stabilizer among the options listed below is the most neutral, weight neutral, and does not increase weight, does not have an increased weight or have a significant impact on BMI? Pay attention to the question. It said mood stabilizer. Well, they're all mostly mood stabilizer. 30 seconds. We talked about this medication yesterday. We talked about the 3 antipsychotics that are least likely to cause weight gain. So if you attended yesterday's event, you should know this question by memory by now. Okay, Lamictal, right? When you hear Lamictal, FDA warning is for Stevens-Jones syndrome. Lamictal is good for those that have depression, bipolar 2, right? Covers the depression very well. But it's also the least likely to cause weight gain, right? So it's a good choice. It doesn't mean that will be weight neutral per se, but out of those options between the lithium and the sodium um, Depakote, it would be the best. Now, Prozac is not a mood stabilizer, right? That's an SSRI. So we have to understand what the question's asking. Okay. All right. Let's see what. Nothing changes here very much. We have semi 4 answers in a row. Number 40. Let's see if we got one more. Mr. Cruz is your patient who has been diagnosed with schizophrenia. During the interview today, you asked about the college class he mentions taken during the last appointment. He responded by moving from one thought to another, discussing unrelated content, but did not answer the question. How should you document this in terms of his thought process? Is it circumferential? Is it incurrent? Is it abreaction or tangential? We have 15 seconds. This is the last question, guys, okay? Let's do this. 9 seconds. And 6. Okay, this tangential. Tangential is when we do not answer the question. We go around, and never answer the question. Circumferential, we go around and around. Eventually says, yeah, I took algebra 2 and English 1 and 2, English composition 1 and 2, right? So a bit different. So, yeah, so Jeanette took the lead on the last questions. Very, very, very close here by one little point. KR, you did fantastic today. Dean, you guys are killing. AJ and TA. If you notice, you guys are the ones that are always here on the Kahoot live night. And I have no doubt that you guys will absolutely pass. Your test will be a piece of cake. Everybody else, Pam is back with the answer streak number 3. Everyone else, good job. Today's event will be cutting a little bit short. 40 questions, I think, was good for us to really touch base on things that we learned. And remember that next Friday we'll be having our live event, right? So we'll be having live event next Friday. It'll be module 2. So your goal for next Friday is to absolutely know in detail module 1 and have gone through module 2 event to have like to be more of to be less of a new event and more of a reviewing things that are going on. Okay, so as we progress, we'll be getting more and more content. So it's very, very, very important that now you take the time to understand fully, leaving nothing behind of module 1. Your goal is to absolutely memorize everything on module 1. And as we move to module 2, now we have 2 content, 3 contents, 4 contents, 5 contents. And then you should, by the end of the 5 weeks, you should know everything in super detail. Okay. Now I'm going to send the link by Wednesday. Okay. If you first thing I want to ask you is to check your spam box. If you don't get it by Thursday, email me. Okay, email me to PMHNP at mpexamcoach.com. Now, this is not a free event, right? So this is part of the people that are enrolled in the 30 days PMHNP Walk to Success with the MP Exam Coach. So if you are enrolled, you'll be getting an email. If you'd like to enroll, there is the link here in a chat box. We would love to have you there. Attend as many classes as you'd like. It's, it's 6 months. You can attend all 6 months of live class if you wish, right? I'm sure every event will be a little bit different. We say things in a different ways, will be different questions. So no problem. Attend as many as you can, but always on Friday nights, 5 p.m. Eastern Standard Time. Okay. Any questions about anything at all before we conclude today's event?
Can you please clarify the prize structure for today?
Oh, yes. So 150, 150. So if you are the first place, well, you got 150. Then if you're second place, you got 100. And if you're third, you got $50 still. So that's towards your next course. If you would like to take the psychopharmacology course, we're having we're doing some behavioral health, cognitive behavior therapy. We are doing other courses that are coming up in the next few months as well. So,
Dr. Lopez, thank you so much. That's very generous of you.
yeah, no, just
I appreciate it very much. I'm going to take your farm course. I'm
yes.
going to put my $100 towards your farm course.
There you go. There you go.
And I remember I won a few weeks ago too. I won 200. So
oh, here we go. You're almost
so
there.
maybe my farm course is free. I don't know. How much is it?
It's actually very inexpensive. It's only $2.99. I mean, that is a year of a course that I would say that this course would probably be the top 5 universities out there right now because it's very intense. You'll learn meds like you never seen before. I promise you. It's not going to be easy either. It's not an easy course. You don't get to really know a whole lot just by asking for easy. But
right.
It's something that is doable with, being a mom, being a wife, being a worker, and you still want to be able to fit in your lifestyle. So I think the balance for that. So,
may I say, and this is real quick, I love Cahoots. I really get so much out of this. I feel probably everybody does. That's why so many people attend. It's a really fun way to learn, and I greatly appreciate you doing this. Really,
absolutely.
It's so nice. Thank you.
Yes,
I just referred you to someone. I think she's here. Monet, are you here? Monet. M-I-N-E-T. Monet Johnson. Monet, I saw your name.
Did she? She may have left.
I just was telling you, she's a friend of mine from Purdue, and I was telling her about the program, and I gave her the information about Cahoots so she could participate. If she's still here, Monet, if you can hear me, I'm going to call you. This is Kim Riley. I'll call you.
Yes, I had another Purdue student that I talked to this morning, but her name was Jill Van.
I'm here.
Oh, I don't think I know her.
I'm here, Professor.
Oh, hi. Hello, Jill. How are you?
Good. How are you?
Good. Yes, so she's here. So yeah, guys. So let's do this. So don't fall behind. If you are just like Jill that just started now, it doesn't matter if you started on module 2. You can catch up, like learn module 1, or you can just don't do module 1 and start with module 2. It doesn't really matter. The only reason is that we're kind of breaking down stuff so that you don't have like 5 hours of content all at once, right? So take the time to love the journey without anticipating what's going to be the outcome. The outcome will come. I promise you. There is no other outcome other than victory. There is no other way other than really understanding this content. Because passing the board is just the beginning. Passing the board is just the beginning. Like, what do we do after, right? We don't want to get sued. We don't want to cause no harm, right? I know all of us, I have made mistakes in life with the patient, simple mistakes sometimes more grievous mistakes. And we don't want to do that. as we are prescribing them, especially, right? Um, but we want to really, really understand what we're doing it, and we want to empower the community, because if you really think about it, the more people know what we do, the stronger we are as a profession. Okay. So this is not really about salaries and things like that. But if people know that you're PMHNP and they're like, oh, you are able to diagnose, you are able to treat, you are able to do all that, eventually we'll get more compensations for what we do as well. Okay. So Aaron, please, did I pronounce your name correctly? Hi, do you have a question? Please unmute yourself.
I have a question. So I did sign up for the 30 days and I was doing some other theoretical studies, so I wasn't able to start the materials until I believe this week.
Okay.
But by the time I started, it said I have 11 days left.
No.
So, yes.
So here's the kicker, right? So the course comes with tons of psychology involved behind it, right? If you are like me, right? I think most people are. We like to postpone things, right? Well, I'll do it tomorrow. If we don't have a deadline, I will just do it tomorrow. I'll do everything tomorrow if I don't have a deadline. So a deadline, it pushes you. So that's why we say 30 days walk to success. But reality is you have 6 months. So don't worry about the clock. When you see a clock, it psychologically it puts a urgency in you to finish or to initiate the program, right? But you are not getting kicked out. You never get kicked out. We will be by your side no matter what. And it doesn't really mean, as long as you are starting, as long as you say, I have a little bit time, we'll be right here to help you. So nobody gets kicked out of the classes, okay? But I gotta find ways to really push you as much as I can. That's my job, to motivate you. It's my job to coach you. It's my job to help you pass this test. So if a little bit of extra points here, a little bit of noise, a little bit of small content, a little bit of PDFs, a little bit of live classes, all things come together for your success. Okay.
Okay, and the last one is, can I get a feedback from my diagnostics test one? Because I refuse to look at the answers.
That's good.
Based on the instructions you gave. So I didn't look at the answers. So
no,
if I can get a
unfortunately not.
feedback.
No feedback, right? The feedback will come after module 8.
Okay.
After module 8, because what is everything is designed for your success. So if you, let's say not you, somebody else, because you wouldn't do this, cheated, and you look at the answer, and then you take the same exactly test, and now you score 90, and you're like, Dr. Lopez, you said if I score 80, I'm ready to go, and I score 90, but you wrote down the answers, you're not really helping yourself. We want to know that you got 50% in the beginning, and that's okay. Totally okay. And then you progress through modules 1, 2, 3, 4, 5, crash course review, module 6, took the test again, module 7. Now your score increased from 50 to 75. Now you should look at the answers, or more precisely, you should lay down all your PDFs on your bed, look at each question. Oh yeah, this question talks about ADHD. Let me review the content of ADHD. And then you can take the same test again 3 days later, and then see if your score improves by understanding, not by memorizing the answer. Now, we're done with that. We are moving to module 8. It will be a second test that you have not taken before. Now it will be like a real test that we need to find out. Now, if you're not scoring still 75 or above, and your test date is coming up, I would highly suggest that you reschedule your board. Don't take it. Okay. We have to figure out where you're getting stuck. We have to figure out where you are getting things confused. And that's when we come to the live classes, and where we'll figure out. It'd be like, hey, acute stress disorder and PTSD, I'm getting those confused. I study, and that's when we'll figure out things. but I do not want you to test if you're not ready. And I will unfortunately tell you, I'll call you sometimes, but like, hey, I know you are testing 2 days. Can we talk a little bit? Can we figure out? I see that you haven't progressed yet. Can we figure it out? And it hurts me. It's a very difficult time. I think it's the most difficult time when I have to tell people, "Hey, you're not ready yet." Okay? Because I don't want you to see you frustrated. I don't want you to see you not passing. I want you to see you succeed. And the goal of the program really is a transformation. Is walking from scared, defeated sometimes, to I am unstoppable. I will pass this test. I deserve my seat on the table. I fought hard to be here. This was a long time coming. And that's the goal. Your goal is to pass. My goal is to transform you. It really is. The passing, it will happen. I promise. That's like a giving. Okay. But what's not giving is the transformation, is how you feel about it. And that's what my personal goal is to transform you, how you think from being, oh my God, I'm so scared, I'm so confused, why do I change my answers all the time, to, I know that's the answer. I'm calm and collective. I got my answers. I came here to do something and I did what I came for. So it's a long journey, to change that mental status, to change from being scared to being very comfortable. It's going to take a little while. It's going to take you pushing yourself to a little bit more than just showing up and doing cahoots, or showing up and taking few questions, right? It's like you don't change your body in 30 days permanently, right? But if you do it, keep doing it, 90 days, not only you see the difference, but others see the difference as well. So,
Dr. Lopez, may I
yes.
ask, please, for clarification on what you just said? I took the two tests. There was the initial test and then the test that was identical to the initial test. There's another test that is not the same test? A third test?
So that is, right? But it's like a pre-test
Yes.
that we don't count. Then diagnose test 1 and 2.
So is 1 and 2 the same content, or is there one that's
No.
different?
3 and 1 is the same content.
Okay, I guess I misunderstood that there was a third test that's totally different. So that's
No.
at the end of module 8?
Yes, module 8 is the second one that's different. There is the pre, and
Yes.
and the module 7 is the same. So basically, it's just
So the
me
pre and
looking.
7 are the same, but there's one more that is different. That is like
Correct.
the definitive bottom line as to whether or not you're ready.
They are similar, but asked in different ways. Just like the content that we are seeing here is all the same, but asked in a different angle or a different way of asking the same thing. Yes. So basically, I'm really making sure that you understand the content and not simply picking an answer because you memorized the test.
So if I log into the 30-day and I go to module 8, I'll find another test that I can take?
Yes. So you go log in, left upper corner, all content.
Uh-huh.
And then all the content should show up. So that's another psychology move that I did on a test, right? Instead of showing you 100 contents at once, right? 100 different videos, I only show you one at a time. So that it doesn't freaking you out. Like, oh my God, I have to do 100 things. Just do one at a time. But if you are testing soon, or if you just came in and you're like almost ready and you really want to make sure that you are on point to test, just go straight to the tests, take the tests, make sure you're developing a dumping sheet. And I'm working on a dumping sheet for you guys. Michael asked me to do that. So I created my mini dumping sheet yesterday for all module 1s. And every module I'll be adding a little bit more. Once I'm finally done, I'll post it to our WhatsApp group. I know, Jill, I have to add you to the WhatsApp group. But that's it, guys. I don't want to take much of your time. I value your time. I think it's super important Saturday night for y'all, right? It's Sunday here for me. I am in Korea, so it's Sunday morning, very early. So, yeah. So, any questions about anything else? Anything that you're feeling stuck that can be helpful to you? We have Temi Lope. Tope, I'm so sorry. I butchered your name.
Tammy is fine. Tammy is
Tammy.
fine.
Okay. Hi, Tammy.
Hi.
How can I help you? Good.
I know, I probably didn't join when you were talking about this dumping shoes. I keep hearing that.
Yeah.
What is that?
Okay. So the dumping sheet, right? It's something that it's very helpful because you have 18 minutes by the time you sit down and read your instructions. So first thing, as you go sign in, they're going to scan you. It looks like you're going to a prison, but it's not. I promise. They're going to scan you, everything. See you, take your glasses out. And then when they're comfortable, they're going to give you 2 pieces of laminated sheets. So first thing you need to do is asking for a new marker. You don't want to use the one. So they're going to give you that. They're going to be like, oh, we don't have one. So, well, you need to provide me one. I'll pay for this test. So they'll give you one. Then you sit down and you have 18 minutes, right? What I do myself, personally, I sit down, close my eyes, I do my meditation. I'm in a mood. I'm ready for this, right? So I'm relaxed. It's like the big day, what I've been waiting for my entire life. So I'm in a mood. So then I open my eyes and I'm going to write down the dumping sheet. So things that I don't want to be confused on, like Erickson stages, right? I'll do a summary of this in my dumping sheet. I'll write it down. Write it down. I'll do medications that cause manias. I'll do medications that are inhibitors or other medications like that that I have acronyms in the course, and I just write down the acronyms, right? Drop that GBS, or I'll say Forcelled, or I say other acronyms that I teach on the course, and I just drop down. Now you are on questions 135. You're already tired, and then a question about Erickson comes up, and you'll be like, "Oh my God, which stage is this?" You just look at your dumping sheet. You'll be like, "Yep, right here. I got the
you're
A."
allowed to keep it. You're allowed to keep
Yeah.
it.
You're not cheating. It's from memory. It's from memory, and it is your time. Now, how you use your 18 minutes is up to you. You can read all the test information. That's fine. As long as you're not bringing anything, you're not cheating. It's from your memory. You're allowed to use the 18 minutes however you want. So I like to do my dumping sheet for 15 minutes, and then 3 minutes I kind of read the test. Some functions of the test you can strike through, you can highlight, and that's important. Now, understanding what we teach you in a course, like, hey, read the question and ask yourself, what is the core of the question? What is the questions really asking me? Because today we had lots of questions about the question about community and suicide, right? It starts with the suicides in high school and then ask about the community. So if you're not really pay attention, it's not that you don't have knowledge of what you do, you did not fully understand what the question is asking you. And that's what we need to practice with every question, right? On the question bank. It's like, I read the question, rephrase it. What is the core of the question? Then by that time, you already have an answer. You just read A, B, C, and D, and you match your answer. So you don't get tricked by some of the things that our test makers like to do, right? So that is the dumping sheet things that I like to do. But now, it should be highly individualized. That's why I don't have one. It would be things that I have difficulties with, but it could be very different for you. You could know Erickson stage by heart, and you don't need that, so that wouldn't be helpful to you. So now it should be something that you are able to do it and be able to rewrite at least 15 times before the test day, because you shouldn't need to know that by heart too, right? Because if you can't remember, then what's good to do a dumping sheet?
Right.
Okay,
All right.
good.
Thank you.
Yeah, I think it's very helpful. You be like looking at your dumping sheet, like, yep, I got it. Another one, good. I'm good. So yes,
Thank you.
absolutely. All right, everyone. I want to be respectful of your time. Is there anything at this time that I can help you with? Any content from yesterday's event, or anything that you feel stuck?
May I ask a question about
Sure.
inducers and inhibitors?
Sure.
There are
Please.
so many on each list, and correct me if I'm wrong, I think you said yesterday that if you memorize the inducers, you can make, I don't know if you, I'm sure you didn't use this word, but kind of like an assumption that if it's
Yes.
not an inducer, it's most likely going to be read in the question as an
Yes.
inhibitor.
Yes.
So
I would do that. I would take my chances because it's like this. I'm not going to put in a course 30 different herbs.
right,
Right?
exactly.
Because I'm not going to clutter your brain with the possibility of
Well, it's
having
too late.
one or
It's
two.
already
Yeah.
cluttered. It's already
Yeah. Yeah. You know, I'm only going for high yield content because
right.
so I'll take my chance personally of memorizing one list. I don't have the
Okay,
time to memorize two huge lists of each
right.
one, 15, 30 different medications, right? I just don't have that time. So I'll memorize one, and these are the big ones that I put in an acronym. If it's not there, I'll take my chances. Now, I'm not saying that's the right way. If you have the brain power, the time, and the resource to memorize the list of 30 different meds, whether
Yeah.
they're inhibitor or then that's all good and probably a better way to do it. But I would take my chance. I'll memorize one list, and if it's not in the list, I'll call it because I have to prioritize. Think of this
Right.
way: if everything is important, then nothing's important, right?
Right.
So
I was just curious because to me, that particular part of module 1 is a little tricky for me,
yeah,
just the way I'm
yeah,
processing it. So
yeah.
I'm looking for a way to make sure I'm clarifying and understanding for myself.
Okay.
So I'll dedicate myself to doing the mnemonic for the inducers and then just assume in the body of any given question, if it's not on the inducer list, it's most likely going to be considered an inhibitor.
Right.
Is that a
However,
fair assumption or?
yes, but the most correct assumption is that you may not be dealing with the inducer or inhibitor. You may
Right.
be dealing with a medication that causes mania or depression. And then people are stuck on inducers, inhibitors. Oh my God, such a popular content. But when
Right.
the reality is neither of, it's just a medication that was added on, especially how do you know? Well, the test we always say X, Y, and Z was stable on this medication. Bling, bling, bling. So basically, something has happened that caused the
Stabilized.
patient to be. So it's no longer a inhibitor question. Something else was added. It was a prednisone added, steroids. Now
Right.
the patient became manic or the patient became depressed because of prednisone. And remember, it will never say steroids. It will say the name
No.
of that medication. So you have to do a little bit deeper digging to find out
Mhm.
what is it. Okay?
Okay, thank you.
Correct. All right. Any other questions about anything at all? Anything that you see in a course that you are stuck? Go ahead, Olu.
Yes, hi. I want to ask about the review that was done yesterday. You said you will post it on the Facebook page.
No.
Okay,
That'll be posted in the course,
in the
inside of
course.
the course. Yeah. So if you're part of the course, you're getting that review yesterday. But yes, it should be only in the course.
Okay, all right. Thank you.
Absolutely. What else, guys, can I help you with? Are you having trouble with anything at all? Okay. So if you are, few things. What's up during the week? Can't wait to ask your question. We're there. What's up? Most students will answer your question. If you still don't want to ask your question via WhatsApp, email me so that I can get your answer. We have maybe 30 different social medias all over the place, inboxes. It's very, very hard to answer to all your questions via social media. So you email me would be the best way for me to get your answers. And if that still doesn't happen, we have Friday nights and Saturday nights to answer any of your questions. I don't want you to ever feel that you're alone or your questions have not been answered. It's just that asking on social media, chat box, different accounts, it gets very complicated for me to find your answer or find that you are asking a question. Are you trying to say something to me? I don't know. That probably not for me, that question. Alrighty. Then
Dr.
sorry.
Lopez, I saw my name on her message. So, and that's why I
Oh,
asked the question.
okay. Sure.
Yeah.
You guys are side talking. That's good. So, alrighty then. Any other questions or concerns that I can help you with? If not, good night, guys. It's always good to see you. Study hard. Okay. Don't leave this. Don't leave this for chances. Okay. Don't leave this for chance. This is your moment. It's your time to shine. This is your. I mean, you should walk in that day like feeling happy. Like I say, the day before you take your spouse, your girlfriend, your boyfriend, your kid, or whoever you want out, go celebrate, because it's like the day you've been waiting for. Remember the time that you said, I want to be a nurse practitioner. This is it. We're here. Nothing should stop you, right? So this is the time to really dig a dip. Oh, I'm tired. Oh, I have to work. Yes, I know, I got it. And I do understand. But if now, then when, right? We are doing this live. We are doing this. Everything is ready for you. So it should be really no excuse why you can take the course. At your fingertips, everything is ready. You know, you can study as much as your heart content. Very, very little is separating you from your best life at this moment. Very, very little. You know, you probably don't want to be a bedside nurse anymore. You probably don't want to be a FNP anymore. Sorry. Maybe some of you guys do. But a lot of people are FNPs. And that's a problem when you come to PMHNP, because you're thinking more rationally, more scientifically based, when the primary goal is to marry science and hope as a PMHNP. So sometimes your answers is not scientifically based, but it's based on hope, right? Providing hope. And that's what people need, hope, all right? So that being said, the link for the course is in the chat box. And that concludes today's event. Super happy to see you all. See you next Friday. If you don't get an email from me by Wednesday, email me or check your spam box. Okay? See you all Friday. Let's ask no other question, right? We're good? Okay. Good night, everyone, then.
Thank you, Dr. Lopez. Thank you
Good to
so
see
much.
you all.
Good night.
Good night, everyone.
Thank you.
Thank you. Bye-bye.